So hello everyone and welcome
Hi,
to this
Sarah.
episode of In the Know. The focus today is on men's health, particularly on prostate cancer and prostate health. So I'm Sarah McNulty. I'm Director of Public Health for Knowsley, work at Knowsley Council, and I'll just go around and ask everyone to introduce themselves.
Hi, I'm Hassan Argommandkhah. I'm Clinical Director in Kirkby PCN.
Hi, I'm Joe Ryan. I'm a patient for Dr Mazzolani up in Kirkby.
I'm Alan Wall. I'm also a patient of Dr Mazzolani in Kirkby.
Okay, so we're here today to talk about prostate cancer. So the prostate is a small gland in men only. Only men have prostates. It's involved in reproductive health, and it's in the news quite a lot, isn't it? So we often hear about kind of prostate cancer, and it's a common cancer. And we often hear about prostate screening. So Hassan, is there currently a national screening programme?
No, there isn't the full national screening program. Obviously, GPs be able to screen patients who have got symptomatics, etc. But there isn't really, we don't call patients the way we do for example, cervical screening and bowel screening. There's no specific national program to pull patients in.
Yeah, so there's often calls for a screening programme, and there's actually a national body called the National Screening Committee that makes the decisions around what's a screening programme, what's not, and they have quite tight criteria so for whether something is a screening programme, and they review it lots and lots. They constantly look at the evidence around it, and at the moment the evidence suggests that actually the harms involved in a screening programme would outweigh the benefits. So that means that just testing people without symptoms who aren't at high risk would cause more harm than benefit at the moment, based on everything that we know. So Joe, so do you want to tell us about your history with prostate, your prostate, so to speak?
About 10 years ago, the old school that I went to, senior school, we had a meeting. So we turned out, there was about 6 of us, as the conversation was going on, there was a lad facing me. I hadn't seen him for probably 40 years. Looked as fit as a butcher's dog, didn't have anything. Halfway through the night, he said, I've got prostate, I won't be able to make the next meeting. So I just looked shocked. I went, well, you look fit as I said, have you got a number on your back? He said, they've told me 3 to 4 months. And I was astounded.
Wow.
I was just gobsmacked. So that was the first thing that sort of worried me. So I left it probably another year after Tony died, and then thought I better ask, I better go, because I was still under the impression that it was an internal examination, and for a man, which is probably stupid, you don't like getting that done. No. Probably similar for a woman when she gets exactly an internal thing. Then I discovered about the PSA, but I only found that out on the day that I went to the doctors. I said, all uncomfortable, it's a bit embarrassing this. Can you do look at set events? It's not embarrassing, let me stop you that there. That's what I'm for. Really explained it, really, really stuck me at ease. And he said the initial thing is a PSA. The PSA test is an indicator for what you may have. He said if we discover anything that's a bit untoward, or then we'll call you in, and then we'll do a test, an internal, and then there's a whole hierarchy of procedures that thing go on. He said, but you've done the right thing, coming in, and you shouldn't think that it's embarrassing. He said, I'm a doctor and it's my role, and he put me at ease. So I become involved with the PPG group, and then Alan joined. and we discovered that like Alan had had the test and he'd been diagnosed, and so that's my. I do know other people since I've become involved in like the PPG group, and somebody go, oh yeah, blah blah blah, is that? And do you remember thingy and all that, and you go away. So then I'm aware of like the campaign that has been like going on. It's a lot more in the public eye, and I know there isn't any screening thing as such. But for me, I think everyone should be invited in for the PSA test, at least. So whether you call that a screening thing, I don't know. But the way other things have been like targeted, come in for your flu jab, come and get this, come and get that, I think everyone should be invited, and I think there should be more education around the fact that there's a lot of men who probably like still think that the first protocol is to like go in and have an internal examination, and I think you get a lot more men through the door.
Yeah. Do you want me to add something? I think it's more prone in older men, if you know what I mean, 50 plus, 60 plus. You know, and the older you are, even if you got prostate cancer, it tends to be of a less aggressive type than if you're younger when you get a prostate cancer. Yeah. So that can be a more aggressive kind, like Chris Hoy, the cyclist. Yeah, I mean, he's quite young when he got it, and he's quite aggressive. But as 75 plus, if you suddenly develop prostate cancer, it's like on a much more slower burner. It's easier to control, etc. So that's probably why your friend, who was fit as a butcher's dog, he was actually, you know, he was more at risk of those sort of risks.
And I think you're right about kind of, you know, raising awareness, most definitely. And there are particular groups who are more at risk. So you mentioned kind of older men.
Black men as well.
Black men, yeah, most definitely. And some of the recommendations are, you know, they potentially should have a test from 45, rather than 50 years old. But also, you know, you say about Chris Hoy, so he had a family history, didn't he, as well, of prostate cancer. So again, just more awareness. So, Alan, do you want to tell us about your experience?
Yeah, well, I've just had an operation to have my prostate removed.
Okay.
The 12th of February. And that was just on the off chance of a PSA, but just on the PSA, you do still get the internal, even if your PSA results high, because then you feel how enlarged your prostate is. Yeah. So that PSA doesn't take away the internal.
Yeah, but you won't have unnecessary internal if your PSA is not raised. I think that's the difference, you see. Yeah. Do you know what I mean? So you do sort of... And one of the things is that around all this is that making sure if you're on long-term conditions, so for example, you got type 2 diabetes, cardiovascular blood pressure, and you got to go for annual blood checks anyway. So if once you got around 50 plus and you have to have these annual bloods, you should maybe have a conversation with your GP practice saying, this year I wouldn't mind if my PSA was done mixed with all that lot you're doing. I'm going already for the blood. They're taking 3 vials off. Let's test in that for PSA. If the PSA is not raised, it's an assurance, isn't it? Yeah. Then maybe repeat it again in 5 years, or if you start getting signs and symptoms. But you could proactively yourself as men, once you get to a certain age, if you've got long-term conditions and you have to have regular annual bloods anyway, maybe throw that into the conversation and ask the practice, is there a chance that you could add the PSA to my blood request this year? And then if that's not raised, it's great, isn't it?
I think the other time when you consider a PSA test is if you had some symptoms. So did you have any symptoms at all?
I'd had symptoms maybe 2 years beforehand. My PSA level had gone up and they sent me for an MRI scan. And the MRI scan was inconclusive. They'd done another PSA and it come back down. So they said, everything's normal then.
So
you're
it could have been inflamed or something like that.
We'll put you on like a 2-year watch. So after 2 years, I got the call off the doctor, go and get your PSA level done again. Got that done, back up again. Back to the hospital, MRI scan. Cancer's there.
So you were being tested regularly because you'd had this
because I had the scare like 2 years beforehand, and then went for a bone scan to make sure it hadn't come out the prostate.
Yeah.
That was fine. At the biopsy, I think they took 28 and 9 were cancerous. So then that was it. Then I then had a choice of hormone treatment, radiotherapy, or the operation to have it removed with the robots, and I chose the robotic operation, which was fine, really was fine. And people say, oh, you've got to wear a catheter. I personally didn't feel a catheter till the day before it was coming out.
Yeah.
Because I don't know whether I was getting more feelings back.
Yeah.
And it did start to hurt. Then, but once it come off, it was fine. And my fear of when it come off was, I'm going to wee the bed when I go home, because you got used to not going to the toilet to have a wee. And I thought, my concern was that I'm going to wee the bed. But I didn't, because I felt it just didn't work that way. Because I was getting up every hour to go to the toilet, but I knew I wanted to go to the toilet.
Well, the prostate gland doesn't sit on the bladder, you see. The control of your V is through the sphincter on the bladder, which has got a little valve there and lets the bladder push the V out. Whereas the prostate is further down on the urethra. So basically, that bit would not have been damaged by the catheter or the operation, you know.
Yeah. So I've since been back to the surgeon on the 15th of April, and my PSA level's 0.001.
Yeah.
Brilliant.
So I've got to go back the 5th of August for another check-up, and if everything's fine then, you said you go back to your GP and everything should be fine then.
So I guess that's a really...
So I personally, I've had a really good experience.
I was going to say, that's a really key message, isn't it,
it's
to
not
get
nice,
out there.
But everyone involved in it was absolutely brilliant. All the nurses, everyone.
Yeah.
Just made it so easy for you.
Yeah. So I think often people don't go for tests, and when they've got symptoms of things, they don't go for tests because they're worried about the what ifs and what would happen. And you're saying it's, it was fine. So just coming back to kind of symptoms and things like that, which I think is like a really important message to get across to people. So, prostate cancer can present without symptoms, but it's important to know what symptoms it can present with.
The 2 years before period, I was going to the toilet quite a lot over the weekend, and I filled it was like during COVID, and I filled an online thing and said, not for that. I had something else wrong with me, but I also mentioned I was going to the toilet quite a lot, and that's when he first done my PSA. But the second time, I had no symptoms whatsoever. I wasn't going to the toilet, It was just that the PSA level had gone up on its own.
So I guess other things could be for other men, they may have difficulty starting to go to the toilet, pee, or the stream might be a little more dribbly than usual, or one of the typical things is that you wake up to go in the night more often. So that's another thing. Occasionally it could be blood in your pee as well. That's obviously something that you need to go and get checked out. But all of those things, men should be aware of, and they might not necessarily be prostate cancer, but it's
worth
something that you
checked,
need to try
Often
and
it could
down.
be just a simple urinary infection, But the main thing is that once you've gone past the 58, if these things are continuous and regularly occur, it's best to have it checked. You know.
So we've talked a bit about PSA without really saying what it is, haven't we? So I don't know, Hassan, do you want to say what PSA is? It's
prostate-specific antigen, which is basically
So it's a test in your blood, isn't it? So it's a blood test, and the prostate produces this chemical, for want of a better word, that can be detected. And there's many reasons why it might produce it at increased levels. It might be just inflamed, or it might be an indicator that there might be something wrong in there. So it's quite a clever little thing.
Especially your gland telling you there is something not quite right here. But the thing is that your brain can't analyze that. Do you know what I mean? You need the blood test.
So one of the things I'm really impressed with what you just said is that you're just happily talking about, having a catheter and having a digital rectal examination and all of that. Do you think that maybe sometimes men feel
I think
a bit...
sometimes it's how you do it yourself, isn't it? It's your own state of mind sort of thing, I think. I mean, it doesn't bother me. I can't do nothing about it, so it's not me worrying about it. the doctors and nurses, they're the ones who do stuff. And personally, I've got it. Nothing I can do.
Yeah. Do you think sometimes men get a bit
I think sometimes
kind of
just,
embarrassed
they
by
just-
it?
Yeah, I did.
yeah.
I did, and like I know like loads who just wouldn't even like walk through the door. So since I've been through the door, I've said, "Go ahead, it's easy. All you do, you just walk in. It's nothing to be scared of. Don't be embarrassed." He's done it 1,000 times.
Yeah.
And
So
yeah.
that's what I'd like to say to anybody else out there that maybe has a little look at this. Like, just go and say it costs you nothing, and it could save
your life at the end of the day, yeah.
And it's good that TV programs and like football clubs and that have started to actually promote prostate cancer awareness. I mean, there is that
Get
little
them badges,
badge,
didn't they, on
with the
Sky
little man.
Sports, yeah, the
they've got that.
Yeah.
I think some football clubs have started in the men's urinal, put little stickers and, where you pee on it and it says, if you see anything abnormal, contact somebody. And those awarenesses are really, really good.
Yeah.
But one thing is making people aware. One thing is you as
It's
a person to
getting
act
involved,
on those.
is getting you through the
So
door.
it's really good, important. This program hears from you guys is that you have experienced this. You can tell the patient. They're not patients yet. Actually, they're men healthy, running around and doing their work. But you know what I mean. Making sure that those people who are aware, they do something about it. That's really the key. And it's some even soap operas. You know, they're like Emmerdale at the moment. They've got a character called Kane.
Okay.
Kane Dingle.
Kane Dingle,
yeah. He's got prostate cancer, but his was accidentally found after that big accident they did on the curry, whatever. Oh, my knowledge is good, eh?
It is.
Yeah, I mean,
Well
they did
impressed.
that program, and after that accident, he was hospitalized, and during his hospitalization, they did a scan. They identified the prostate cancer, and he's been going through a lot of anxiety, a lot of not being able to cope with it, with the catheter and all that sort of thing, which I think is trying to make people aware that it's nothing to be worried about. If you actually get it, do something about it.
Yeah.
And it's good those
And
things, awareness
they're good
are
at doing
happening.
that, soaps, aren't they?
Yeah,
They're really
It's,
good
I mean,
at
it's
getting
not
it
that
out
bad. And you're only in the hospital. Well, I was in the hospital overnight, and I was out the next 4 o'clock the next afternoon.
Yeah.
And you know, prostate cancer is one of those ones that, you know, if you do catch it early, then you can.
It's easy treatable. Yeah,
absolutely.
Yeah.
You know, it like you say, it's nothing to be worried about. The doctor's had that conversation with someone a million times. Even if you do need an exam, the doctor's done it a million times. You know, it's not anything to be.
But it's getting that message out there.
And especially to men who aren't always.
I'm indestructible. I'm the big tough hard
I'm
fella.
indestructible. Yeah.
And a good proportion of them can be well controlled by tablets or injections every 3 months. Do you know what I mean?
Or just monitoring.
Or monitoring,
sometimes.
you know, depending on the age. So there are really good treatments out there. But as with anything with medicine, if you leave it to the last minute, you're probably going to fall off the edge.
Too late,
Do you know what I mean?
Yeah.
If you put the foot on the brake early enough, you're going to stop in time before you're going over the cliff. You know?
Yeah. So what's the single most important message that we want men out there listening today to remember? Just say, Alan.
To get a test, to get your PSA level tested. Don't and even the internal, don't worry about it because it's over within probably 15 seconds. And you just, you know, if it's enlarged, you know there's something there, could be something there. I'd just encourage anyone to get it done. I really would. Even if you haven't got symptoms. Because I never had symptoms the second time. But I had it. So I'd definitely say to people, get it done. Don't be scared.
Similar, like, message. I'd just dress it up slightly, like, differently. I'd say, like, don't put this big, like, facade on. I'm indestructible.
Yeah.
Because if you have got it and you don't know, you're leaving behind a family, kids, like grandkids, and you won't see them. You won't see them growing up because you're being stupid and stubborn and not going through the door. That's what I'd say.
Okay, thank you. They're amazing messages. Thanks for coming today to everyone.